What are the benefits of dental implants? The big benefit of dental implants, of course, is probably undoubtedly the closest thing that you can get to having your tooth back. That doesn't really matter whether it's a single tooth, multiple teeth, or all of your teeth. The advent of dental implant technology and the way the componentries are manufactured and how successful they are, this is now considered a very routine procedure. It's also got much bigger benefits according to their alternatives. With bridge work, for example, if you're missing a tooth, we've got to do something to the two teeth on either side, and that's a very old school way of fixing missing teeth. But it brings other teeth into the game, and that's particularly a really bad idea in my opinion if there's nothing wrong with the two teeth on either side. And of course over conventional dentures or partial dentures where the size of the dentures and the fact that they're removable is really an off-putting thing for a lot of people. It takes up a lot more real estate in the mouth and affects your speech and all these other things that you have to get used to, not to mention the fact that they're removable. So the big benefits, I suppose, is that they're a fixed replacement. They're pretty much the closest thing we can give you to having your tooth back. They do need a lot of maintenance, but no more than a normal tooth. And the fact that it's considered a very routine procedure today. So what are the disadvantages of replacing missing teeth with the various different options that are available? The dental implant, I suppose the only disadvantage is really two things. It's more cost and there's a small surgical procedure involved in doing it. Apart from that, the benefits really do outweigh the disadvantages. When it comes to bridge work, it can be a good idea in very limited circumstances, but the big problem with bridges is that you've got to involve other teeth. When you do that, you're really adding more variables to the equation. We see a lot of bridges that have been in the mouth over long periods of time that just break the adjacent teeth when the whole bridge falls off, and now you've got a much bigger problem to deal with than just a single tooth problem, for example. And if those adjacent teeth are perfectly healthy, why would you involve them? And I suppose the disadvantages of partial dentures I might have mentioned is they're removable, they take up a lot of real estate in the mouth. A lot of people, I reckon about 30 to 40% of patients we make partial dentures for throw them in the bottom drawer because they never really tolerate them that well. But that said, they can be a good option for people as well. It's a much lower cost option, but I suppose the only disadvantage of the surgical part of a dental implant is a bit of discomfort for 3 or 4 days, maybe a little bit of bruising, a little bit of swelling. Like most invasive procedures, even having a tooth out these days, we do expect those sorts of things to happen. That doesn't tend to be an issue over long periods of time. So when it comes to talking about the surgical procedure itself involved in placing a dental implant, whilst nothing is risk-free in biology, a lot of that's impacted by your own medical history, etc. But we find that in the most majority of cases now, as long as these cases are planned very, very carefully and very considerately, that these procedures end up working out very well. But that said, we do expect a bit of soreness, bruising, a bit of swelling in some cases. We find people don't have any problems at all, but other cases find a bit of soreness for a few days. And usually after about 3 or 4 days, they're completely dissipated.